Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, Healthy Living Tuesday continues right here on Extra. Dr. Jitka Lom from Express Care is here. Doctor, we are talking about dizziness and vertigo and lightheadedness and a whole bunch of things that, you know, very, very uncomfortable and like in most cases, grounds to go see a doctor. So we do have some questions. People posted these on our Facebook wall. You can do so yourself anytime at KUAM.com/Facebook. And our first question comes all the way from down south from Sandra from the Southern Village, the beautiful village of Maritzo. She says, how can balance disorders, Dr. Lom, affect an older person?
Well, they affect an older person in a profound way because they, of course, risk falls. And then, you know, elderly can break their hip or hurt their back, bump their head, become unconscious. All kinds of bad things can happen to them. But mainly, it instills a sense of fear and lack of independence because their balance is off and they're afraid to walk, they're afraid to go out, and they can really be limited in that way. So it is important to try to help our elderly with their balance problems. Sometimes the problem cannot actually be cured, but at least we can give them assistive aids such as a walker or wheelchair or whatever to help them get around.
Now, is there anything you can eat or are there any exercises you can do to maybe strengthen your equilibrium?
Well, it's a great question. Things that you can do depending on the cause of the balance problem. Foods can affect it. Again, in a high salt diet, you might develop more dizziness problems because in our inner ear, we have 3 semicircular canals, tiny, tiny little canals that have fluid going through them, kind of like battery fluid. It has a charge on it. Mm-hmm. And those 3 canals, depending on how they're positioned, where we are in the world, we'll know, how, you know, we'll be able to maintain our balance. And if we eat a lot of salt, it will affect the charge inside that battery fluid inside there. Okay. And so that can affect us sometimes. Otherwise, training yourself to be more balanced is very helpful. So exercises like Tai Chi, like yoga, simple walking, training yourself, you can actually improve your own balance, like the gymnasts do. Okay,
good word. Question number 2 comes to us from Mighty, and this comes from Christina. And Christina asked Dr. Lom, a friend of mine said that he suffers from vertigo. What exactly is it? We touched on this in the earlier segment. And how is vertigo caused?
Okay. Well, almost everybody has experienced vertigo also. All you have to do is stand in a room, spin your arms around, and go around in a circle, and pretty soon you'll start to see the world spinning around. Or if you've been on a roller coaster, you've experienced that maybe, mm-hmm. or a ride at the carnival. Anyway, so what happens there is that, as I was mentioning, the semicircular canals in the inner ear, the fluid starts going the wrong way or gets just a little bit messed up in its flow, and as a result, your body, your brain will not know where you are in the world, and so you'll start to feel very uncomfortable. The world will be spinning around. You'll start to feel very nauseated, and even your eye movements may be funny to other people who are looking at you.
It's basically like a mechanic scale, you know, with a bubble that goes, you know, in between the lever.
It's true. Sometimes there can even be bubbles in there.
Mm-hmm. Okay. Yeah. All right. So our third question says, Dr. Lom, are there any medications that can be prescribed to cure vertigo?
Yes, there are. Sometimes they're not that effective, but they can be prescribed. In general, rest and helping the problem in the inner ear is helpful. So, for example, if somebody has an ear infection, some antibiotics might help their vertigo. Other times, there actually can be a tumor on the nerve that supplies that area, and then that needs to be treated. Most often it's something called benign positional vertigo. It's caused by a virus like a cold in your inner ear, mm-hmm. and it just takes time to pass.
Okay. Our next question, no addressee on this one, but Dr. Lom, this person asks, there are days when I have headaches, when I'm lightheaded and dizzy, specific to days. Should I be concerned? If it's only on certain days, I would think so.
Yes, you know, it depends on the age group of this person. If they're an elderly and they're having this problem, then I think they really need to be checked, especially if they're having an irregular heartbeat or if they're having stroke symptoms or having a high blood pressure. On the other hand, if it's a young woman that's having headaches with dizziness and lightheadedness, she may just be anemic and have a low blood count and need to take some iron and build up her blood, and she'll be fine. So it really depends on the age group of the person and what other symptoms they're having.
And see your medical professional just to make sure. Okay, last question comes to us from Jonya, and Phil asks Dr. Lom, is there an age where balance disorders are more common?
Yes, at the extremes of age. So young children will be quite clumsy, fall over more easily, and then the elderly, as we talked about, will have more problems. anybody after they've been ill for a while, if they've been in the hospital and so on, may also find that they're a little bit unsteady on their feet.
Okay. All right. Well, thank you so much for the knowledge once again, and we will see you next week when we will be